Moving on to video 2 with the muscles. Kind of the coolest thing ever because muscles, right? Like, I don't know. I like muscles. So, realistically, when it comes to the shoulder girdle, we're talking about 5 major muscles. We're going to have all of those muscles that originate on the axial skeleton and then insert on the scapula or the clavicle. Take a second, pause, think about what that means when it comes to scapular movement. Everything's originating on the axial skeleton and everything is inserting on the scapula or the clavicle. That means we're going to dictate the movement of the scapula based on how we know muscles contract, which is we move from the insertion towards the origin, right? The origin is going to generally stay pretty static. The insertion is going to move towards the origin. So that means we are dictating scapular movement based on muscle contraction. These muscles do not attach to the humerus and do not cause shoulder joint actions. Whenever we are moving the shoulder joint, these muscles are going to be providing a base for which the shoulder joint can articulate. They're going to be controlling movement of the shoulder girdle to allow the shoulder joint to function. 5 major muscle groups, all originating on the axial skeleton, all inserting on the scapula or the clavicle. Major hallmark point here. So these 5 muscles, we're going to have the traps, upper, middle, and lower traps. We're going to have the rhomboids. We're going to have the levator scapula. We're going to have the serratus anterior. And we're going to have the pec minor. Serratus anterior, the serratus, are probably one of the coolest looking muscles ever. I gotta admit, like serratus, if someone is just lean out of their mind, it's a cool looking muscle group. So the pec minor muscle, everyone knows for the most part, don't want to generalize. Most people know the pec major, right? This big fan-shaped muscle. However, the pec minor is just as important. So it's going to have an origin on the anterior surface of the 3rd, 4th, and 5th ribs, or the 3rd to 5th ribs. And it's going to insert on the coracoid process of the scapula. So if we're over here on the right-hand side, we can see that we have our origin on the ribs, and we insert on the coracoid process of the scapula. If you were a betting individual, which direction would you think that this would cause movement? Right? It draws the scapula forward because it pulls on the coracoid process. So it's going to pull the coracoid process forward. And that's going to also tend to tilt the lower border away from the ribs. So it's going to almost cause this motion right here, right? Because we're drawing the scapula forward from the coracoid process, just like you're pinching it and grabbing it forward. So the pec minor is going to be responsible for that protraction movement and kind of pulling that coracoid process forward. It's also going to play a role in downward rotation because it's going to help pull the scapula back down. So if we wing it up, if we allow that upward rotation to occur, then we have an origin on our ribs, we have insertion on our coracoid process, and as we contract our pec minor, you're going to actually feel that we're going to be pulling that scapula downward, right? That pec minor, because of the way that the origin and insertion are, we're going to actually pull that downward rotation to occur. And then it also allows for a level of depression. So as the scapula is from here, as we're in this shoulder elevation position, the shrug position, we can help contract down with our pec minor to activate and to pull those scapulas back down. Our trapezius are going to be one of the other major muscles associated with the shoulder girdle. If you look over here, you can see that the origin is on the base of the skull, the occipital protuberance, so right here, right on the back of the skull, the posterior ligaments of the neck. You're going to have the spinous process of the C7, cervical spine 7, as well as on thoracic vertebrae T1 through T12. So realistically, our traps are running from the occipital protuberance all the way down to the bottom of our rib cage. That is the origin of all of our trapezius muscles, upper, middle, and lower trap muscles. Then the insertion is going to be the posterior aspect of the lateral 3rd of the clavicle, so all the way on the outer side of the clavicle, on the most lateral edge of the clavicle, on the medial border of the acromion process, and then on the upper border of the scapular spine, right? So this is going to, if you think about the origin of the trapezius, sorry, I'm like looking at the computer as I'm drawing this. So if you're looking at the origin of the trapezius as it's running all the way down the spine, and if we know that it is inserting on the clavicle out here and on the upper border of the scapular spine, the upper border of the scapular spine, as we contract, you would expect the scapula to move this way. You would be pulling on this scapular spine, so you would expect the scapula to rotate this way. You'd expect an outward rotation of the scapula, right? Also, you would expect a scapular elevation to occur because we're pulling up, right? Oops, sorry. Because we're actually pulling up, as we're contracting, we're pulling up on the scapula, you would expect to see an actual elevation of the scapula occurring. The middle fibers, you can see here, right? So upper fibers, the middle fibers are more what's tying in this area. They're going to be responsible for elevation, upward rotation, and adduction. So we're actually going to be bringing that scapula back towards the vertebral column with those middle fibers. We're going to actually be pulling it back towards. So if we're retracting our shoulders, we're actually, if you put your hands on your traps as you retract your shoulders, you can feel your trapezius muscles contract. You can feel your middle fibers of your trapezius muscles contract hard. And those lower fibers are going to be responsible for shoulder depression, because if we're originating down here and we're inserting up here, we pull down on that scapula. We're actually pulling that scapula down and back into a medial place. And we're going to have adduction because, again, we're pulling it back towards the vertebral column, and we're going to allow for an upward rotation. So if we're pulling on this area of the spine of the scapula, you would expect to pull on the medial side and actually upwardly rotate that scapula. Levator scapula. So this muscle does exactly what it sounds like. It's going to elevate the scapula. So its origin is on the transverse processes of the vertebral columns of the upper forecervical spine. So it's going to, right up here, is going to be where the levator scapula is, and it's going to be responsible for pulling and elevating the medial margin of the scapula. So if you go through a shrug, you can actually feel that levator scapula activate, and it's going to insert on the medial border of the scapula. So it's actually going to, based on the angle of pull, it's going to pull the scapula up. And that's why it's also a weak adduction, because the origin is more medial than the insertion. It's going to also serve to pull that scapula in towards the midline as well. Now, our rhomboids are a little bit complex because they have a large range of origin again, and they have a large range of insertion again, right? So they're kind of a big fan, if you will. So our major and minor rhomboid are going to work together. Our rhomboid minor is going to be originating on the spinous process of the last cervical and first thoracic vertebra, right? So we're going to be down here. Oh, sorry, I'm an idiot. We're going to be down here. So we're going to be putting on the last cervical, C7, in our first, I keep losing my cursor, C7 in our first thoracic vertebra. Our rhomboid major is going to be on the spinous process of the second through fifth thoracic vertebra. So if this is C7, T1, then this is going to be T2, T3, T4, and T5. Those are our origins of a rhomboid minor and a rhomboid major, all along this vertebral column. We're going to insert the rhomboid minor on the medial border of the scapula, so along the midline border of the scapula, above the spine of the scapula, just barely, and then the rhomboid major is going to be on the medial border of the scapula, but below the spine. So Rhomboid minor, C7, T1, right up here. Rhomboid major is going to be down here, right? So below the spine of the scapula. So what they're going to be focused on is adduction, right? If you can look, you can see that the angle of pull is not great. It's not like it's the levator scapula where it's pulling this long distance at this higher angle. Instead, it's almost like it's going to just be pulling and retracting the shoulder blades back towards the midline. That's exactly what it's going to be doing. It's going to also allow for some downward rotation when it's in an when the scapula is already in an upwardly rotated position. So imagine that this scapula right here has winged out and up. The rhomboid is going to be responsible for pulling that medial border back towards the midline, back towards the vertebral column. And there is, because of the slight upward angle of these of the rhomboids, there is going to be a small level of rhomboid activation when it comes to scapular elevation. But for the most part, it's going to be retraction and downward rotation with minimal levels of activation coming from elevation or scapular elevation or shrugging, right? If you ever noticed that no one can do a shrug without making like a really goofy shrug face, it's kind of a fun thing to do in the gym. I don't know. Another major muscle group that's going to be controlling the shoulder girdle is going to be our serratus anterior. If you look, the origin of the serratus is on the upper 9 ribs on the side of the chest. So it's along the mid-ax line, and it inserts on the anterior aspect of the medial border of the scapula. So it's running deep. So if our humerus is here, the serratus anterior is actually running from mid-ax line, pretty close to mid-ax line, and then into the medial border. So it's actually running underneath the scapula. So if it's running underneath the scapula and inserting on the medial border of the scapula, it's going to be pulling the scapula forward, right? Our angle of pull, origin, insertion, our angle of pull is going to serve to pull and drag that scapula forward. So it's going to be abduction or protraction, right? We're going to be pulling that medial border away from the vertebral column, away from the medial line. It's going to also be associated with a level of upward rotation. These low fibers down here are actually going to be pulling this low end of the medial border forward, and when that happens, you're actually just pulling the medial border, this inferior angle, farther away from the midline than you are the upper section of that medial border. So it actually allows for an upward rotation of the scapula. Another major muscle is going to be the subclavius muscle. So it's largely responsible for stabilizing the sternoclavicular joint. You can see that the origin is on the superior aspect of the first rib, and then it inserts on the inferior groove of the clavicle, right? So we're essentially making sure to keep this sternoclavicular joint in place as much as possible as the SC joint is moving or as the shoulder girdle is moving. Because of the origin being below the clavicle where it inserts, you're going to be pulling down the clavicles, so you're going to be depressing the shoulders, right? Depressing the shoulders because, the origin is below the insertion. We're going to be pulling down, and that's going to be the subclavius. So let's think about the movement of scapular abduction. For me, I don't know why, I think this is one of the more complex movements of the scapula to understand. An example of this is I want you to imagine a really poor bench press. Someone is laying down on the bench, and every time they press up, their shoulders are well above their sternum, right? I don't think you guys can really tell. So my sternum is right here, and my shoulders are all the way forward. So they are protracted. Another good way to think about this is go down into a push-up position and then press your upper body as far away from the floor as you can. Almost like you're doing like cat pose, right? I think that's called cat, right? I don't know. I don't do yoga. But you're trying to push away as far as you can in that position of the shoulder girdle. That scapula is kind of winged out. is going to be scapular abduction. Scapular adduction, right? So abduction is we're pulling farther away from the midline. Adduction, again, is we're pulling towards the midline. When it comes to scapular abduction, we're going to be moving the scapula away from the center line, away from the midline. The major agonists associated with this are going to be our pec minor and our serratus anterior, right? Because our pec minor is going to be pulling on that coracoid process, and then our serratus anterior are going to be pulling that medial border of the scapula forward, or trying to bring it away from the midline. Scapular adduction, primary agonists are going to be our middle traps, our lower traps, and our rhomboids. And again, make sure you think about this, right? What is adduction of the scapula doing? It's bringing the scapula back towards the middle, back towards the midline, back towards the vertebral column. So if our traps run along the length of our vertebral column and insert on the superior side of the scapular spine, it's going to be pulling the scapula back towards the middle because it's going to pull from origin to insertion, right? And again, the rhomboid should be painfully obvious because their major action, the major muscle action is shoulder adduction, because we're going to be running along the vertebral spine and we're going to be pulling that shoulder blade, that scapula back towards the midline, because we're going to contract from origin towards insertion. So the insertion is going to come closer to the origin. Scapular upward rotation, major agonists are going to be middle traps, lower traps, and serratus anterior, because we're going to be pulling the superior spine, the scapular spine, up, and we're going to be rotating the scapula, right? If you're looking at the angle of pull, lower trapezius down here are going to insert all the way on the medial side of the scapular spine. And as they contract, they're going to actually pull this medial border down, which is going to rotate the inferior angle externally. And then our serratus anterior, our serratus anterior is going to be responsible for abducting, right? So if we're pulling the scapula away and we're rotating it, we're going to get that upward rotation. As we're pulling scapula away and we're rotating it, we get that upward rotation. Scapular elevation is going to be primary agonists, levator scapula, upper trapezius, middle trapezius, and rhomboid somewhat. So if we think levator scapula, origin is on the cervical vertebrae. It inserts all the way up here on the scapula, on that medial border, on the superior angle of the scapula. It's going to be pulling the scapula upward and inward. You're going to have the rhomboids pulling in an adduction style. So we're actually going to be pulling the scapulas in and somewhat up based on this very minimal angle of pull. And then the upper trapezius, remember how they fall, or they insert onto the superior side of the scapular spine. You're going to be pulling this scapula inward and upward. Make sure that you are thinking through what the movements are, memorizing the muscles that we're talking about, their origins and insertions, because then it will help you make this feel like common sense. Because if you know the origin, you know the insertion, and you know the general anatomy, you can start to visualize how these muscles, based on where they're pulling on the bone, is going to actually manipulate the bone to cause the movement.